Yes.
Thanks for having me.
Thank
Thanks.
you for,
Yes, I will basically I will describe a little bit what we're doing with this Tracing the Tracer project, and more generally what kind of findings we're finding around the use of ADM systems, automated decision-making systems, in the context of the pandemic. And basically, this is a necessity that we had that was born out of the Automating Society project. That was the previous project that I managed, and it's a long, detailed report about how these systems operate in Europe generally, and in 16 countries in particular that we studied. But not, of course, when the project started out in 2019, we weren't expecting the pandemic to take the world by a storm, basically, and to take our work by a storm also. And so we needed to find a way in which to include, of course, the way in which the pandemic impacted on the realization and deployment and the trialing of many ADM systems, as you all know. We decided to keep it independent from the report that we published at the end of the year, called Automated Society 2020. And we decided to have a kind of preview report in which to focus through the network that we used of researchers that work with us to try and understand what was going on back then by the summer. So let's say a lot compared to now, a lot is missing, of course, in that report. And for that reason, we wanted to have a kind of a permanent monitoring platform, one that can be always updated and that can be much more diverse in its scope also. So back then, when we started studying the topic, we mainly had to start to look at contact tracing apps or exposure notifications apps. And now it's no longer the case. Now it's many more systems, many more instances, and deployed in different uses and in different ways. And so this Tracing the Tracers project, thanks to this funding from the EU AI fund, is basically the idea is to have a monitoring platform that can be always updated with different kind of contents and different levels of analysis. So we will have, and the website on which this platform is going to run, it's about to be released, and let's say in a week or a couple of weeks maximum, I think. We're working on the back end right now. We will have basically a database of news items that tries to collect findings and interesting news from sources around Europe, around the world, really. It's really important for us to also understand what's going on outside of Europe, of course, to try and make sense of the larger and broader context, and what kind of dangers also are posed in states and context, let's say, that are less democratic than ours. So that is also something that is interesting to consider. And we will also have, and we already published one, more in-depth analysis. One analysis that we published is around digital vaccine certification schemes, of course, and the main result there, it was basically that if you look at the overall, the global picture of this attempt of regulating, or let's say reopening travel routes, and in many cases even venues inside the same countries, this is a patchwork of solutions so far, and it's really difficult to see how one single standard can be imposed somehow globally, which is what would be needed to actually allow travelers to go to travel, of course, around the world without having to download different apps to speak to different institutions, of course, and to have data treated in different ways in different contexts. So it's going to be very difficult to understand whether actually it will be possible to implement such a scheme, even only within the European Union, of course, if it would be possible to implement it in a non-discriminatory way, as the EU is trying to do so, of course. But the fact is that we're finding that, for example, in many cases, some local authorities and regions are actually anticipating that kind of scheme. And for example, in Italy, we have in Alto Adige, we have a Corona Pass that grants and allows access to Corona Pass areas, which is kind of interesting as a way to put it. If you have the pass, you can dine indoors, for example. You can go to the gym, you can go swim, in the pools. And if you don't, possibly not, or maybe you will have another area of your reserved for you. So it's going to be, it's not exactly non-discriminatory to me. It does look like you will have like class A and class B citizens. So it's very concerning, and it should be studied very intensively. By the way, in Italy, we've been having the Data Protection Authority every day basically saying this is not consistent with privacy legislation. You should be careful. Another analysis I'm working on is around prioritization algorithms to give the vaccine shots, basically. And we have some instances around Europe and outside of Europe. But again, I wanted to concentrate on something that I know a little bit more. So I try to understand a little bit better how 3 algorithms that are being deployed in Italy work and will work possibly. I know there are many talks around the idea of having it implemented in more regions, and it's an interesting case in itself. And again, we've seen minor, let's say, minor mismatches. A system that was supposed to also prioritize and give the location of where to actually get the vaccine, maybe having the wrong location and forcing people over 80 to travel for 50 kilometers to get a shot, maybe, which is, it doesn't sound much, but it is much for a lot of people. So again, you get advantages and possible drawbacks there, of course. And the next one I'm going to be working on is a very important question for us. Is to try and understand the actual efficacy and whether these contact tracing apps worked, and what is becoming of them, which is another interesting aspect in terms of non-discrimination and rights. We've seen some countries, actually. I'm seeing some countries started out with the centralized apps, and so with privacy preserving, let's say the most privacy preserving scheme, turning to centralized apps somehow. We've seen this, for example, in Scotland, in Germany, with this Luca app, maybe apps that are becoming tied to QR codes or entering premises, again, to keep track in a different way, of course, of the movements, of mass movements, and of course, to keep track on the pandemic. So we've seen all of this. We will have a kind of final report at the end of the year. The project is supposed to last throughout 2021. But of course, in terms of possible biases, I think the most problematic situation right now is around just a handful of solutions. Let's say the vaccine certificate scheme still risks of being discriminatory to me, because even if you open it up to people who get tested, for example, as in Italy or in the EU scheme, you were basically saying that if you have the money to pay for the test, you can travel and you have access to basically your life as before the pandemic. And if you don't have the money to test, you need to be lucky enough to get a free test somewhere or somehow. Otherwise, you won't be able to travel. Imagine what it means for a family to go from one region to another in Italy. If they have different degree of risks and therefore different colors, you will need to have a pass. And maybe you will need to spend 30 euros per test. A family of 4, both ways, it's 240 euros just to go somewhere. So, that is still discriminatory to me, even though it's not vaccinated against the unvaccinated. And on the other hand, we've seen a lot of attempts to use face recognition or biometric technologies, of course, even in the context of the pandemic, maybe to enforce social distancing, maybe together with thermal scans. And of course, we know that the EU is trying to regulate this. There are many loopholes, as we found, and we have a policy position published on our website on that in particular. But of course, the EU regulation is not going to come overnight. And in the meantime, what I suspect is that, especially now that producers and deployers know that they're going to be regulated, they're going to be pushing very hard to try and insert these technologies in stadiums, as it's happening, to enter the premises in many cases, to monitor populations, or in public places, maybe for social distancing enforcement. So again, this needs to be taken care of pretty soon. And that's why also we would have welcomed a moratorium just to interrupt these users that we're seeing popping up everywhere, basically. And the general and final point that I want to be making is that we really, through the use of these systems in the pandemic, we're really normalizing some kind of new surveillance infrastructures that are, of course, born out of the emergency, but we don't really know whether they're going to end up with the emergency. And we all know that emergencies are easy to declare and difficult to undeclare, let's say. So it's really tough to understand when an emergency, especially like this one, is over. And what I fear and what we fear and many in the field fear is that, you know, we're building infrastructures that are not really transparent, that are not really maybe necessary in some cases, and they're there to stay, basically. And we need to be very careful about what kind of idea of democratic society we want and how we want to reconcile, of course, the public health and public security with freedoms and fundamental freedoms and rights. And we do think it's possible to have both, but it's going to be tough to explain and to show actually to a lot of people who are trying to actually do the opposite, claim that many fundamental rights are unnecessary, given that there is a public health emergency. So basically, this is what I'm doing, and I don't want to take too much time. And if there are questions, of course, I'm more than happy to answer.